checking out my video. Today I'm going to talk to you about helping to deal with some of the side effects of gemcitabine and docetaxel chemotherapy. These are some tips that are going to help you get through it and help reduce the misery of the procedures and the side effects. I'm going to do 3 videos. The first one's going to be the start of your infusions. The next one's going to be about continuing infusions. And the last video is going to be about general safety when you're a chemo patient. I'm a 4-year cancer survivor, currently being treated with docetaxel and gemcitabine. The first tip I'm going to give you is to how to eliminate an injection, a painful injection. If you're new to chemotherapy, you will find out that your team will place a port in your body to have access to your bloodstream so they don't have to poke your veins every time. It's a relatively simple operation, outpatient, in and out in about a half a day, and they'll leave this port inside your body. They access this port when they give you your infusions. To access the port, they will use a little needle and clamp device that goes into your skin and into this port. There's a little bit of pain involved, and the nurse that accesses the port will say, "Would you like a lidocaine injection?" And that'll help to numb the port area. Well, that's a pretty painful poke. The first tip I have for you is when the doctor says we're going to give you a port, ask him to write a prescription for lidocaine cream. Lidocaine cream you can apply to your port about an hour before your access or infusion. Cover it up with a little bit of plastic wrap so it doesn't get on your clothes. And it will significantly numb that area without having to have an injection. In my opinion, I think it does just as good a job as a lidocaine injection. You saved 1 poke. And if you're a cancer patient, you know you get a lot of pokes. Through the course of your treatment, that can really add up. The next thing I'm going to talk to you about is poop. That's right, poop. Poop's important to talk about when you're a chemo patient, especially when you're getting chemotherapy, because the drugs that they give you tend to be constipated, and being constipated is a drag. It makes you feel bloated, it decreases your appetite, and it's difficult to pass constipated stools. So the best way to treat constipation is to pre-treat it. And my next tip is to teach you how to pre-treat constipation. If you have something that you can eat that will cause you to go to the bathroom regularly, get on that a couple of days before your first infusion, so that when you do your infusion, it will be easier to pass your first stool. For me, pre-treating constipation involved a couple of things. I first use Miralax. This is a Costco product. It's a lot cheaper than the brand name. I also use and take regularly a spoonful of psyllium fiber. You can get this in a lot of different forms. This is powder. Costco sells it. Or you can also get it in pill form. What this will do is to help you pass your stools easily and will help to reduce constipation. Constipation is important so many ways. Most importantly is it will help you, if you can pass your stools easily, it'll help you to feel like you want to eat. And eating is your energy. Food is your energy. And energy is something that you need to conserve. My last tip of the day is to consider taking a log of your experiences and your feelings day to day. Sometimes it's just of your temperature. I recommend that you also do a daily log of things like your level of fatigue and energy, any pain that you're feeling, any discomfort, the condition of your body, how you feel. The reason that's important is when you do this for a number of weeks, and I'm now at about 20 weeks, I forget what day I feel certain symptoms and side effects, and it helps to predict that. So to be able to say, day 3 out of an infusion, I will usually feel like this, it helps for planning. So poke, poop, and planning. 3 things, 3 tips to get you through the first part of your infusions. The other thing that I want to tell you is listen to what your doctor says. These are just home remedies, not medical advice. Your doctor will give you information about side effects of your particular type of therapy. Some of these side effects require medical attention. If you do experience a side effect that they list as requiring medical attention, call the doctor. Don't use a home remedy. That's very important because there may be an issue that a doctor needs to deal with that a home remedy is not effective for. I hope you found this helpful. I hope that your treatment goes well, and I hope that you have no evidence of disease on your next scan. I'll look forward to seeing you on my next video. Take care and be well.